Well, the procedure we're doing in patients with symptomatic multiple sclerosis is to try to open up the central veins that drain the brain and the spinal cord. There is a theory that multiple sclerosis may be partially caused by venous pressure or hypertension, venous hypertension in the neural tissue of the brain and the spinal cord. And I'm not a neurologist, I'm a vascular surgeon, so I'm learning this as we go as well. But the neurologists tell me that this used to be an old theory of multiple sclerosis and then sort of fell by the wayside when the immunologic theory came around. And now it has once again become prominent as a possible cause for the patient's symptoms. So there was a study in Europe that showed that when these blockages in the veins that drain the brain and the spinal cord are opened and relieved by balloon angioplasty, then the patients got better. And balloon angioplasty is something we do in many other parts of the body. It's done in the heart, it's done in the legs, it's done in the neck arteries. So it's something we're very familiar with, but this application of angioplasty is a little new to us, especially in treating multiple sclerosis. So what we do is when we have a patient that first has an ultrasound exam, which is a non-invasive way, we put some jelly on the skin and get some ultrasound pictures. There are certain criteria that if the ultrasound exam fits those criteria, then we decide we need better pictures of the veins. So the patients get an ultrasound. If the ultrasound determines one of 4 criteria that are positive on the ultrasound exam, which is non-invasive, then we get a more invasive examination called a venogram, which is an actual picture of the veins. And that's done through a small catheter that's placed in the leg vein after we numb the area and make the patient drowsy. And that will give us exact pictures of the main veins that drain the brain and the spinal cord. And then if we see blockage in one of those veins, we can put a little catheter in called an intravascular ultrasound catheter, and that gets us a picture of the vein from the inside. So we get a picture of how it looks from the outside and a picture of how it looks from the inside. If we see blockage on those 2 images, then through the same catheter we can place a small balloon and inflate the balloon to open up that blockage.
And the balloon comes back out.
And then the balloon comes back out, that's right. The question will be how durable that opening is.
What does that mean?
Well, durable means how long it will last. So when you do angioplasty of a vein, sometimes it can collapse back down. And that's why people sometimes consider putting in a stent. And a stent is a little piece of metal like a Chinese finger trap that they use we use that in arteries and in veins in other parts of the body. But some people have proposed using a stent in this situation. We are not going to do that right off until we get a little more experience with the disease process. Yeah, we're doing just the balloon because there are some possible downsides and dangerous occurrences that can happen with stenting in this location. So to be as safe as possible, we're going to do just the angioplasty and then follow the patient's symptoms. Now, if the patients get better, which we hope, and then, unfortunately, if their symptoms return and we see that those blockages are returning, we may in the future decide, let's go ahead and put a stent in certain situations. But this is a learning process. We are doing this in an investigative manner, and I really want to emphasize that. I think we are perfectly set up for that. We're an academic medical center. We are doing this under protocol. We are doing this very carefully. We are gathering data, and that's one of our main forces driving us, is to gather data on this whole process. So it's a learning process for all of us. And we're gathering this data to hopefully make the therapy better in the future.
So again, emphasizing, because I know Dr. T did it as well, is that this is not something we should be jumping up and down and saying it's a cure-all. We are still in the very early stages. We're taking baby steps here.
We are in the very early stages. We don't know how this is going to work. And the community is divided. Some people think it's not going to work at all. Some people think it's going to be very effective and successful. So we believe that we're perfectly positioned because we have excellent neurology, we've got the capability to do the procedures, and we have a good data gathering system. So we're hoping that we can put that all together and get some real answers.